Well, good afternoon, everyone. Today, I want to provide an update on COVID-19 in Illinois and what we're doing to help our residents stay healthy and manage through the recent intense surge of the disease. With record COVID-related hospitalizations here and across the nation, the most important strategy that we're following is to make vaccinations, boosters, and masks as widely available and utilized as possible. Around the world, Omicron has moved through populations rapidly since it was first discovered less than a month ago, almost 5 weeks ago. It's the most transmissible variant yet seen, and it has the potential to overwhelm healthcare across the nation. This current wave of COVID is causing more people to get sick than ever before in the pandemic. And the vast majority of the serious illnesses and deaths are among the unvaccinated. But as difficult as this moment is, there will be an end to it. We have all the necessary tools for prevention, and we are nearer than ever to having everything we need to detect and treat the disease to keep even the most vulnerable people alive. I can't say enough about how extraordinary our hospitals and our healthcare heroes have been throughout this pandemic, but specifically in the present moment, when exhaustion and long hours greet them every single day. From Chicago to Marion, from East St. Louis to Rockford, medical professionals and staff are caring for our family members, for our neighbors, our friends in this hour of need. They need help, and I'm doing everything that I can to support them as they tackle this latest surge. To give them a reprieve and to expand the number of staffed hospital beds, 2,048 healthcare workers have been deployed across the state. 919 of them are on site supporting hospitals hit hard by COVID right now, with another 552 arriving at hospitals by next Friday. We have also created COVID reaction teams to respond quickly to emerging crises at hospitals and other healthcare facilities. These teams have 237 healthcare workers in the field already, with another 340 arriving over the next 10 days. Even more personnel are being made available to individual hospitals that apply for federal assistance, so the state is helping to expedite their applications. As an example, just today, a dozen additional personnel are beginning to work in the Rockford region. That's help being provided by the Federal Emergency Management Agency. Throughout this crisis, state government has had to be innovative and agile to find creative solutions to maintain healthcare capacity during this unprecedented crisis, delivering assistance, waivers, and guidance to our healthcare institutions as they pursue creative and safe solutions to build capacity for patient care. For example, just this week, we're expanding on that support with additional steps. First, out-of-state healthcare workers are now able to continue working in Illinois during the public health emergency with expanded permission, allowing them to care not just for COVID-19 patients, but for all patients in need. Second, doctors who received their medical training in another country can now provide assistance to licensed physicians here in Illinois in a healthcare institution. And further alleviating the strain on the broader medical system, we are allowing out-of-state providers, including physicians and nurses and mental health providers, to provide telehealth services to individuals here in Illinois, if there was a pre-existing provider-patient relationship. With unprecedented numbers of patients being hospitalized, we must do all that we can to keep our healthcare workers and institutions operating and available to all who need medical assistance. I encourage everyone to help. The most important thing that you can do right now is to get vaccinated, get boosted, wear a mask to stop the spread. I also want to take a moment today to address our schools. The best place for kids right now is in the classroom. And I'm so pleased that hundreds of thousands of Chicago students are returning to school with their teachers. Health and safety must be our primary concerns for keeping schools from going remote. That's why since last year, my administration has been providing help to every school district in our state that needs it, obtaining vaccinations, masks, and testing. That's as true in Chicago as it is in the collar counties, as it is in central or southern Illinois. Children and teachers belong in schools, learning in a healthy environment. One of the sticking points toward resolving the standoff in Chicago was testing. There wasn't enough. So my staff and I worked night and day to find more tests, a scarce commodity everywhere in the nation, as you know. But Illinois came through. We have some real leaders here, in Robert Ford at Abbott, and in President Tim Killeen, and in Ron Watkins, who leads the SHIELD testing program at U of I, who answered my call for 350,000 rapid tests that helped break the impasse. Parents, teachers, and students are very grateful. I was pleased to deliver these tests promptly on Monday so that they could take that issue off the table. I will continue to work with all districts throughout the state to provide what they need to keep schools safe and open. So far across Illinois, we've held 1,645 on-site vaccine clinics in schools and day camps, with another 350 more scheduled. We've provided 3.8 million masks for school staff and for students. We've completed more than 2 million tests in schools through the SHIELD program and sent more than 1 million rapid tests into school communities. Vaccinations, boosters, masks indoors, and testing are the key to keeping schools open and to maintaining safety standards for staff and students alike. I want to end my remarks today with a request to the more than 8 million Illinoisans who fully vaccinated. First, I want to say thank you. Second, if you have a friend, a relative, a coworker, or a neighbor who is hesitant about getting the vaccine, talk to them about your experience. This week, my administration launched our On the Fence campaign to publicly share the testimonials of Illinoisans who were initially vaccine hesitant, but are now fully vaccinated. Those stories are crucially important, but nothing makes a difference more than hearing directly from the people that you know. So I encourage you to start that conversation with people you know and love. But last but not least, fully vaccinated Illinoisans are eligible to get their free booster shot, which multiplies by 10 your protection from COVID hospitalization. You can find a booster location near you at vaccines.gov. Thank you, and now I want to turn it over to Dr. Ezike. Doctor.
Thank you, Governor. Good afternoon, everyone. I know we've been asked multiple times over the last couple of days if we've actually seen the peak of the Omicron surge. While it's too soon to tell, but of course we would all love to report that good news, we know that we have to continue with masking and vaccinations and boosting, and we look to get there soon. Unfortunately, right now, today, the hospitals are bearing the brunt. 9% of hospital ICU beds are available in Illinois right now. And that's an ICU bed for anything, COVID or non-COVID. These beds are not designated. Every hospital bed occupied by someone with COVID who was not vaccinated potentially could have averted that hospitalization. And we're making it difficult for people who are having a heart attack, who end up in a car crash, have their appendix burst, have a cancer-related complication, any kind of medical emergency. We're threatening the ability of those people to get the care they need. More than 7,100 people are in the hospitals across Illinois with COVID-19, and the vast, vast majority, over 80%, are unvaccinated. For Illinois, if someone is not vaccinated, they are 11 times more likely to be hospitalized with COVID than someone who actually is vaccinated and boosted. Imagine yourself as one of the nurses or the doctors that's going into the umpteenth patient room to treat a person for something that was preventable. Our healthcare workers are burning the candle at both ends and in the middle as well to care for COVID patients who could have avoided the hospitalization if they were up to date on their vaccine. I hear people say, oh, I know someone who had the vaccine and they still got sick. But please don't equate someone with a cough, runny nose, or sore throat to someone having to be admitted into the hospital and need precious hospital resources. Of the 7.7 million people in Illinois who've been fully vaccinated, 0.08% have been hospitalized with COVID. That's not less than 1%, that's less than 0.1%. So no, we know that these vaccines are effective and are extremely effective at keeping people out of the hospital. We all know what to do. We've all heard this, but we actually need to do it. We need to get vaccinated. We need to turn vaccines into vaccinations. We need to get boosted. We need to continue masking, continue testing. We should come together and do what's right for our greater good. And in light of next week, Martin Luther King Day, also the National Day of Service, as a commitment to our communities and serving others, please consider taking those steps now. Now I'll summarize comments in Spanish. Buenas tardes. Nos han preguntado varias veces en los últimos días si hemos visto el pico del aumento de Omicron. Es demasiado pronto para decirlo, pero tenemos la esperanza de que con el continuo uso de máscaras, las vacunas y los refuerzos podemos llegar más pronto. Pero nuestros hospitales son las más afectados en este momento. Solo el 9% de las camas en la unidad de cuidados intensivos en hospitales están disponibles. Eso es una cama para cualquier persona, para cualquier enfermedad, COVID o no COVID. Cada cama de hospital ocupada por alguien con COVID-19 que no fue vacunada potencialmente está tomando la cama de otra persona. Alguien que tuvo un ataque cardíaco, un accidente automóvil, un revento de apéndice o otra emergencia médica. Más de 7,000 personas están en hospitales en Illinois con COVID-19. Y el 80% de ellos no están vacunados. En Illinois, alguien que no está vacunado tiene 11 veces más probabilidades de ser hospitalizado con COVID que alguien que está vacunada y reforzado. Escucha a personas decir que conocen a alguien que fue vacunada y se enferma. Entonces, ¿cuál es el punto? El punto es eso. De los más de 7 millones de personas en Illinois que han sido completamente vacunados, 0.08% han sido hospitalizadas con COVID-19. Menos de 0.1%. Quiero que nuestra comunidad latina escuche. Ahora es el momento de recibir su dosis de refuerzo. Ahora es el momento de protegerte a ti y a tu familia. Ahora es el momento de seguir adelante y no rendirse. Use su máscara, vacúnese y anime a otros a hacer lo mismo. Muchísimas gracias. And with that, I'll turn it over to Governor Pritzker for questions.
Thank you very much, Dr. Ezike. Happy to take questions from members of the media.
I actually have a question for Dr.
Sure, of course.
Okay, what do you look for? Why are we not able to say that we've seen the peak? Because the numbers do appear to be very slightly down.
Yeah.
What do you need for a peak?
We just want a consistent trend, you know? So I know in certain jurisdictions, they can tell you that in their hospitals, they've seen several days of a decline in the total number of COVIDs in the hospital. Statewide, over the last 24 hours, there was a small dip, but the 24 hours before there wasn't. So you really want to see a consistent decline. I will be the first to announce it when we can say that pretty confidently, crossing my fingers and toes, but I just don't want to get ahead of ourselves. We still need to make sure that we're doing the things that we need to do. And I haven't mentioned, but also we can prevent more admissions to the hospital by getting our flu shots. Just looked at the flu shot numbers, and we are only 20% vaccinated in the state of Illinois. That's lower than the national average. So that's another way that we can give a break to our healthcare workers. That's by getting our flu shot and trying to prevent a flu admission as well.
What is the national average?
I think it was like 23 or 24, so we were several points under.
And Dr. Ezekis, since you're right there as
Sure,
well.
sure.
The governor was talking about the two different ways of helps on the way. Healthcare workers, 552 arriving by next Friday. COVID reaction teams, 340 people arriving in the next 10 days. Can you explain the difference between those two different, the COVID reaction team versus the healthcare workers? Like, those are two separate numbers, but I don't understand.
So there's different buckets. We're really trying to pull on every lever to get help throughout the state to all of our hospitals. So there are federal teams that are coming on board that are providing assistance in specific hospitals. We also have multiple contracts to provide nursing staff and other medical staff to help supplant the loss of staff. So again, we're pulling on every lever to try to get as much help in as possible, whether it's paying for nurses, whether giving opportunity to hospitals to use that contract, or using some of the federal resources, the different assistance that's being provided in terms of some of their strike teams and assistance. Yeah.
Governor Pritzker, a question for you. The Biden administration announced today a plan to send millions in laser tests to school districts. How is that going to be playing here in Illinois? And also, while the state provided a bunch of rapid tests for CPS recently, with a district this size, that's not going to last forever. How do you keep that flow going?
Well, we're not in the business of providing all of the tests for every school on an ongoing basis. Local public health departments and local schools have put in place testing regimes that they are relying upon. For example, last summer, we introduced schools to SHIELD, and over the course of several months, many schools, in fact, almost 300 or 200 and some schools, decided to adopt a SHIELD testing program. When I say schools, I mean school districts, not schools. We have about 850 school districts in the state, so about 250 or more decided to put in SHIELD. Other school districts chose other solutions, which is fine. And then there are school districts that have needed more tests. They put in a small program, and then as there's been a surge, they need testing. And so we have a state stockpile that we try to continually replenish. Obviously, that's been more difficult over the last month or so. But we try to continually restock, and then we send tests out where they're needed as needed, but it's really on a kind of emergency basis where schools say they need help.
And again, about the Biden administration, is Illinois going to be involved?
We certainly want to be a recipient of those. Every state, as far as I know, at least every responsible state has raised their hand and said, you know, we would like to be part of that program. So we hope that many of those tests, and particularly they're at-home tests, as you know, that are being distributed, and there are some going to schools as well, but they operate much in the same way. And so we want to make sure we get as many of those tests as possible. And as you could see, even over the weekend, as we were trying to solve for an immediate problem of getting kids back in school in Chicago, you know, I'm not averse to picking up the phone and calling the CEO of a company that might be, you know, have antigen tests or other kind of testing to get those tests and make them available to whoever needs them in the state.
And could you explain the payment of those tests? Because it did seem to be a bit of a
Sure.
misunderstanding.
Sure. So as you know, every school in the state, every school district in the state received federal dollars for managing through COVID, both for learning as well as for tests and other things. And so we at the state level, we receive a certain amount of money for the state, and then the city of Chicago receives a certain amount of money for the city. Those are two separate amounts of money. Chicago gets treated as if it were an independent state, just like a few other major cities around the country. And you're not allowed to intermingle the federal funds for testing from the state with the funding that was received at the city. So we couldn't move tests that were acquired with the federal funding for the state to the city. And by the way, we don't have enough tests at the state level in order to provide that and still provide the tests that are needed for schools that are requesting them on an urgent basis. And so we wanted to make sure that we provided what they needed, but they have to use the dollars. And as you, I think, reported, they got a certain, I think $81 million you reported that they received for testing. And that seems like it would be enough since this was, I don't know, perhaps $1.5 million worth of testing. Yeah, I'll come back to you. Yeah, go ahead.
At one point, you were protecting compelling Illinois private employers mandated vaccination. I asked about it. At this point now, it seems like the Supreme Court is going to throw out President Biden's federal OSHA rule that would have large private employers vaccine requirement. Should that come to pass, would you consider any similar state action for labor?
We're following that federal rule. So if the Supreme Court throws it out, that won't be something. We just had to prepare. It's for governments is what we put in place. Governments that have 100 employees or more are required to follow this federal mandate. And so we changed the rules in Illinois to align with the federal rules because we're required to. And we had to create an opportunity for them to set it up because it wouldn't go into effect. They have to put a plan in place, and then they have to present that plan as of, I think, late February. And so we wanted to give them enough, notice ahead of time so they could get prepared in case the Supreme Court affirms the Biden administration request. Yeah, that's not something we have in Illinois, nor we haven't put that in place, no. No, I'm saying we haven't and we don't, and that's not that's a federal policy, right? And so, yeah, the answer is we're trying to follow the federal program.
Got it. Can I ask one for Dr.
Well, no, you know what, I have to just follow up on that.
Sure.
Because it's on the
And I'll
website
bring
for-
Dr. Zeke up.
But the
I'll ask
Department
Dr.
of Labor's website is talking about the federal regulation of the state statute and putting that rule into effect for employers under the jurisdiction of Illinois OSHA.
That's how
not government.
OSHA gets effectuated in Illinois through Illinois OSHA. So, I mean, that federal OSHA. We're not creating anything new that the federal government isn't.
Illinois OSHA covers public employers like local municipalities. Federal OSHA covers all of the other private employers. So we have two different kinds of OSHA in Illinois. If you need more on that, I can connect you to the Department of
Yeah,
Labor.
but we're required to follow the federal OSHA. That's why we put in the rule in place that you're referring to.
Okay, so what you put in place on January 7th, quietly, without any press release, I mean, can you explain the decision on that, what's happening?
It isn't anything new. We had to. It was literally something you had to put in place so that local governments could prepare. They're not doing anything different today. We're all waiting to see what the Supreme Court will do, but there is a deadline for people to put a plan together. I'm talking about local governments. And so we wanted to help them prepare. That is our requirement, in fact. Did you have a question for Dr. Zeke? Yeah.
Your counterpart in Florida, the Surgeon General there, Dr. Joseph Levisa, is doing really better at things with public health policy. He's recommending that people only get tested for COVID if they're symptomatic or high risk for complications. He's also spoken about natural immunity in comparison to getting vaccinated if you've already had COVID. Obviously, Florida is a really big state. I wonder if you could give your impression of these public policies that are coming out there, as a public health professional yourself, and why Illinois may not be following them.
You know, I think every state health official has enough to handle with their own state. And we know that throughout this pandemic, Illinois has taken stances that other states haven't. And to show for that, we have had one of the lowest mortality rates of all the states. So I stand behind the decisions and the policies, and I will leave other states to, other state health officers to handle their states' policies as well.
Dr. Zeke, can you talk about the historical context of what we're seeing in the hospitals right now? When I jumped on the COVID metrics today, and I was looking at comparing the ICU bed numbers, and I don't remember it ever being this dire, but correct me if I'm wrong. I mean, it seems like we're at a point in time, historically speaking, with the hospitals, where is this the worst point in time that we've seen with them?
We have never had this many COVID patients in the hospital at any point in the pandemic, not in spring of 2020, not in the winter of 2020. This is the absolute highest number, and not just by a couple. Our previous totals have been smashed. The previous totals of COVIDs in the hospital were about 6,000, I think 6,000, and we're over.
175.
But who's counting? 6,175, and we are at over 7,100. So we have significantly passed all previous records.
What other areas of the state
I mean, the truth is, I was on a call with all the chief medical officers of the hospitals across the state today. They are all crying the same thing. They all need help. They have a significant number of staff that have left the profession because of the exhaustion and the stress and the trauma that they've endured over the last 2 years. We have a large number of people that are quarantining or actively infected themselves. And so that decreases the total number of beds that are even available, because just having a bed for someone to lie on and you don't have the staff does not count as a bed that you can use. So we're starting with a lower number of beds because of the decimated workforce capacity, and then we have this unprecedented number of patients that are presenting, again, completely different situation from when we had our peak last year, because everyone has the opportunity to be vaccinated and therefore prevent the vast majority of these hospitalizations.
Perhaps you said, but could you reinforce, where did you find the extra workers to come? Because I would think every state would be kind of.
Yeah, so it's, we don't ask all the questions. All we know is that we are paying, and unfortunately, very high costs, very, very high costs that we have to pay. We established these contracts a long time ago, which essentially indebted them to provide us nurses. So I think the fast action and the preemptive action that we took to secure those contracts has allowed us to have the nurses that we need for this situation now. But ideally, we would just limit the number of people who are going into the hospital. If 80% of those 7,000 COVID patients, if those hospitalizations could be averted, we would not have a situation that the hospital CEOs and CMOs would be decrying right now. And we would not need the surge staffing or the extra contract staffing or the FEMA teams on the ground.
You know, there's been talk of just a healthcare collapse from a national perspective and what's happening in different areas. I'm curious, like, when you're talking about this, where's hospitalization situation? Where do we stand with this? I mean, from a healthcare overall standpoint in our state?
Well, yeah, that's a much larger conversation. We know that we've had, even before COVID, there was a healthcare workforce shortage. And so there are many strategies that need to be implemented, thinking about how to recruit people to the fields, thinking about different class designations within the healthcare force that maybe don't require as many years or decade of training. And so bringing people into the healthcare force by those other means. So there's a lot that needs to be done. That's the big picture that needs to be tackled, because whether it's COVID or something else, we do need to have an adequate workforce that can deal with any potential emergency. And so that's another ongoing problem to tackle.
We'll do one more.
Yeah, so again, if we're remembering what is the limiting factor isn't the location. The limiting factor isn't a bed. The limiting factor is the people. So you can open McCormick. There are, you can set up cots and beds. You still need individuals, trained medical professionals to work for the people who will be in that bed. So you still come back to that same lowest common denominator, and that's what we're talking about, like needing to replace that healthcare workforce shortage.
All right,
Can I
thanks,
just ask
everyone.
the governor about the cost factor and bringing in these extra nurses?
Yeah.
Does that COVID money from the feds help the state with that, or where does that come from?
Yes, although, just to be clear, hospitals are also utilizing the state's contract in order to bring in personnel that they need in their hospital they are paying for. So mostly that is where dollars are coming from. They also have been supported by the federal government, as you know. Not enough, not on an ongoing basis, but they have received some support in that regard. I just want to respond to one other thing, and then we'll wrap, which is because two of you asked a similar question about the strike teams, and you were asking about, well, what are you doing in places like Rockford or other places where they're running short? The answer is that's what those strike teams are really about. It's when a hospital is, because we have beds, like the physical bed and a room, but if you don't have any staff, that's a useless location. And so those strike teams are designed to, when there is an acute need in some area, to literally take some of those staff and send them on a temporary basis to open up those beds to make sure that everybody can get treated. So,
All right,
thank you
thanks,
very
everyone.
much.